There are a lot of differences between working at an academic and a non-academic center, and I think it's crazy that the majority of trainees don't get exposure to the non-academic setting, even though the majority of us end up going into community care or private practice. So, for example, to talk about how is the ICU different. So I work by myself in the ICU, right? So that means that I have to call the consultants, I do my own notes, I round all that good stuff, right? I don't have really like, interns, residents, or fellows. Sometimes I have a medical student, okay? So on rounds, for example, the nurse presents to you. So the primary nurse will present the patient. It's not necessarily like a whole H&P per se, but they will give you like a history. They'll give you any major like overnight events, and then they will hit like highlight points. And most places have like a sheet that they want the nurse to go through. So we have one for our group that the nurses hit things that we want to talk about. Okay. On this multidisciplinary rounds, the charge nurse is there, the RT is there, pharmacy is there, dietitian is there, social work is there. So it's still very much multidisciplinary rounds. The nurses can put in orders for you. They put in NGs, they take out central lines, swans, whatever, you name it. They're very, very well trained. And they've been phenomenal. The other thing is like the way consultants work, right? So in a private practice or a community center that has private practice physicians, there's a lot of like different groups sometimes, okay? So you kind of get to pick, quote unquote, who you want to consult. For nephrology, there's like 3 groups here, or like ID, there's like different groups or whatever. So it's very much different. I also chose community care because I want to hone in on my own skills as an attending before I teach somebody else. I want to make sure that I feel comfortable with all procedures alone, right? Like intubating and things like that. I don't have backup. I need to be fully comfortable in my set of skills before I can help someone else start their own skill set, right? I also don't really like research, so I didn't want to go into academics. I don't like the politics that come with academics. So this kind of just like worked better for me. The pay tends to be better as well in community or private practice compared to academic settings. Let me know if you have any questions.